Immediately, and then we will have a picture. Please, go ahead. Thank you very much. A few seconds to take pictures. Thank you very much. I would now like to invite the 5 partners on stage. Please take your seats. President, I believe you can already come to the podium since you're the first speaker.
Take a seat.
Take a seat. Thank you, President. You have the floor.
Thank you very much. Dear Bill Gates, lieber Werner Hoyer, Dr. Tedros, dear Catherine Russell, the global campaign against polio shows the power of science, but it also shows the power of our unity. Since 1988, when WHO launched the global eradication effort, the number of polio cases has dropped by more than 99%. 16 million people have been saved from paralysis. And polio eradication is now finally at hand. But the final stretch can be the most challenging. So I'm glad that today we are launching a new partnership to get through this last mile, so that humanity can wipe polio off the face of Earth, just like we did it with smallpox in the 1970s. Today, the European Union, the EIB, together with the Bill and Melinda Gates Foundation, are committing more than €1 billion to global health efforts. Half of this €1 billion will go to the Global Polio Eradication Initiative, dear Dr. Tedros, to support the WHO in finishing what you have started. This will cover polio vaccinations for nearly 370 million children annually. Together we can end the transmission of wild polio already this year and defeat it completely by the end of the next decade. So let's get it done. The other half of our €1 billion pledge will be invested in making health system stronger. Stronger in countries and regions that need it most. For example, for local vaccine production and manufacturing. We have learned our lessons from COVID-19. Every continent should be able to produce the vaccines and medicines it needs. It is a matter of fairness, and it is key to defeat global health threats. And this is why our Global Gateway investment plan is already investing in local vaccine production around the world. Global Gateway has more than €1 billion for Africa's vaccine manufacturing, and the results on the ground are beginning to show. I visited last year the Madiba vaccine manufacturing project in Dakar. It is progressing well. And soon a similar facility will open in Kigali, in Rwanda. We are also supporting vaccine production and manufacturing at scale in Latin America and the Caribbean. But it is essential that we all join forces on this. The road to large-scale manufacturing is very complex. It requires factories, but also training of thousands of workers all across the value chain, as well as health sector reforms. So we need to partner, and we need to keep up the good work that has begun in the wake of the pandemic. This new partnership of old friends, if I may say so, shows that our focus on global health continues. Together, we will end polio. Together, we will support all continents to produce the vaccines and medicines they need, because it should not matter where you're born and where you live. Health is a universal human right. Thank you very much.
Thank you very much, President. I now invite Mr. Bill Gates, co-chair of the Bill and Melinda Gates Foundation.
Well, good afternoon, and thank you for coming to recognize this incredible milestone. I want to thank Ursula von der Leyen and the European Commission and our partners from EIB, WHO, and UNICEF who are, it's all great they're here today. As was mentioned, humanity has only eradicated a single disease, smallpox, and that was over 50 years ago. But today, we're on the verge of ending another, wild polio virus. Wild polio virus, which once paralyzed 7,000 children every week, has only paralyzed 9 people this year, all in just 2 countries, Pakistan and Afghanistan. While wild polio is nearly gone, there are also another 280 children who've been struck by a different polio variant this year. I visited many of these communities where children are still being paralyzed by polio. And of course, in low-income countries, it's a devastating blow, and all the more heartbreaking because it can be stopped. Melinda and I first started supporting this fight in 1999, and we're as committed today through the Gates Foundation to this cause, to ensuring that no child anywhere in the world faces this disease. Our foundation is proud to be part of this new partnership between the European Commission and the European Investment Bank. The 1.1 billion euros we'll be investing together will protect 370 children against polio every year. And this is a key element of finishing the job and getting to full eradication. Plus, a lot of these resources will go to make sure that cutting-edge, life-saving innovations are available to people in low- and middle-income countries. Too often, health innovations get to low-income countries a decade or 2 decades after they get to rich country. And a big reason is the lack of access to financial instruments and investment. With this new financing, our partners will develop more tools that protect people's health, including vaccines and therapeutics, and make sure they're available to everyone who needs them. Our foundation is very grateful to the partners who've made this joint work possible. I especially want to thank Dr. Werner Hoyer as he wraps up his time at the EIB. As a polio survivor, you understand the impact of this disease, and as EIB president, you've stepped up the bank's commitment, not just to polio, but to global health and development more broadly. This is the kind of dedication we need to create a world where no children are suffering from preventable diseases. I look forward to seeing the progress we'll unlock together. Thank you.
Thank you. I now call Mr. Werner Hoyer, President of the European Investment Bank. The floor is yours.
Thank you very much, ladies and gentlemen. Thank you for being with us today, for announcing a groundbreaking collaboration in the global fight against polio. Today we have a great opportunity write together the final chapter in the history of polio and eradicate this disease forever. I thank our partners for their fantastic cooperation. I thank, first of all, our teams at the European Commission, at the Gates Foundation, WHO, and EIB. That work is not done by the presidents or CEOs. But I particularly would like to thank Ursula von der Leyen, Bill Gates, Catherine Russell, and Tedros Adhanom Ghebreyesus, my good old friend, and he's doing much better than a couple of weeks ago in New York. I'm happy to see this. And we have now developed also a very, very close cooperation with UNICEF, and that makes me particularly happy, in particular when we talk about polio and children. We have achieved a lot so far. A large part of the world is basically polio-free. Cases are low, but big risks remain, especially in vulnerable countries. Until this spreading goes on somewhere else, we risk to see emerging waves of the disease. And just last year, polio re-emerged in New York City. So it does make a lot of sense to focus on eradication as an investment with a very strong case and a historical opportunity for humanity. We need a last push because eradication is not an easy feat. Polio cases have gone down massively in the last decades, from the hundreds of thousands in the 1980s to only a few in 2022. We're now meters away from the top of a very steep mountain, but this is, of course, like always, the most challenging part to climb. It is the part where all strengths and skills are needed. This is the part that can be won through focus and perseverance. That's why I'm proud and happy about this partnership. It shows that we can reach eradication, putting together financing, philanthropy, multilateralism, policy, and a shared vision. At EIB, we are proud to partner with great and committed partners like the Gates Foundation, WHO, UNICEF, and of course the European Commission. Thanks to the Commission's support, the European Investment Bank will be able to provide more than 1 billion euros on new innovative financing to increase immunization worldwide and strengthen health systems, ensuring primary health care for people that have no access to it, especially, but not only, in Africa and Asia. This funding will bolster the efforts of key partners here today, UNICEF and World Health Organization, who each play key roles in the implementation of vaccination campaigns and disease surveillance. You can count on us at the EIB to build together innovative and ambitious financial schemes going forward. We can face global challenges leveraging on our respective strengths. We can tackle underinvestment for fundamental human development initiatives. And today, I feel more confident than ever to say we can eradicate polio. Thank you very much.
Thank you, Mr. Hoyer. I now invite Dr. Tedros Ghebreyesus, Director General of the World Health Organization.
I think after many of the speakers, after Ursula and Bill and Werner, I would say I endorse everything that they have said and go, but I will say a few words. So I hope you will bear with me if I repeat some of the things they have said. Your Excellency, President Ursula von der Leyen, Bill Gates, co-chair of the Bill and Melinda Gates Foundation, UNICEF Executive Director, Catherine Russell, European Investment Bank, and my good friend, President Werner Hoyer, Excellencies, esteemed members of the media, dear colleagues and friends. When the Global Polio Eradication Initiative was established in 1988, there were an estimated 350,000 cases a year I think Bill had described this in a different way as well. So far this year, just 3 cases of wild polio virus have been reported in one area of Pakistan and 6 in one area of Afghanistan. We stand on the threshold of making polio only the second human disease in history to be eradicated. But if we are to do that, we must reach the hardest to reach children in the most marginalized communities. It's therefore an honor to be here today for the announcement of this innovative financing mechanism, which aims to do just that, with 1.1 billion euros in funding for health, including 500 million euros for polio eradication. I thank the European Commission, the European Investment Bank, the Bill and Melinda Gates Foundation, and our sister agency, UNICEF, for coming together to join in this life-saving project. We can only eradicate polio if we vaccinate each and every child. Children who are unvaccinated or only partially vaccinated typically live in remote areas in communities with little access to health services. This new financing mechanism will allow us to reach those children. This agreement goes beyond polio to deliver vital health services to children in remote and marginalized communities, including measles, vaccines, and other routine immunizations. The new funding will also be used to strengthen health systems to better prepare and respond to emerging health threats with diseases like COVID-19 and Ebola. I again thank our partners for coming together to help build more sustainable and resilient health systems among the world's most vulnerable populations to help us along the path of universal health coverage and health for all, but especially today's main purpose, to eradicate polio. And I join Werner in saying we can end polio. This is the final push, and we can do it, but we should keep pushing. And I would like to join also Bill in appreciating Werner for his leadership as you're wrapping up. And still, I know the passion, your passion in the eradication of polio. Although you're retiring, you will be changing a tire to finish polio. Thank you. Thank you so much.
Thank you. Finally, I invite Mrs. Catherine Russell, Executive Director of UNICEF.
Thank you very much, and good afternoon. It's really great to be here with you. This is such an exciting day, and I think this partnership is a great example of what we can do when we all come together. As you've heard, polio eradication is finally within reach, thanks to the tremendous generosity of our partners and their support for the heroic efforts of health workers and community influencers around the world. But the progress we have made against this disease is fragile, and we cannot afford to relent in our efforts. For most of us, polio evokes long-ago images of iron lungs and children in braces. But for some children, the possibility of a lifetime of paralysis or even death is very real. And that is true even though we have had the vaccine to prevent it for decades. Millions of children are still missing out on this vaccination. And that's for a host of reasons: pandemic-related disruptions, conflict, climate disasters, displacement, and increasing vaccine misinformation. Most of these children, as Dr. Tedros said, live in the poorest and most marginalized communities with limited access to life-saving vaccination and health services. These are the places where the insidious polio virus continues to thrive and to spread. The funding announcement by the partnership today will be critical to our efforts to finally vaccinate all of these children against polio, and it will support the strengthening of community-based health systems, including community health workers who are on the front lines every single day. Ultimately, this effort can help ensure primary health care for every child, everywhere. There are so many forces in this world that debilitate, maim, or kill children. As hard as we try, and we try very hard at UNICEF, we cannot prevent all of them. But we can prevent polio. And if we can, we must. Thank you very much.
Thank you very much to all of our speakers. This now concludes our launch event. Thank you for having joined us today.